It's my pleasure to welcome the Community Services Benefits Trust people here today. We have a team of 4. I want you to know that this is really what started the conference. Back in January, we were talking about plans, what we wanted to do for the year, and we knew that a lot of people were telling us that they needed information about benefits plans, that the nonprofit sector is typically under-resourced in terms of benefits plans, pensions, as well as other kinds of healthcare plans. So we wanted to play a role in helping the sector develop a better understanding and hopefully better access to the plans that are available. And we met with Kirk Longmire, who is based here in Nova Scotia. He's based in Berwick. This is a pan-Canadian organization, so it's a good fit, I think. It's pan-Canadian, but there is a strong representation here in Nova Scotia. So having said that, I will turn things over to them. I hope you'll find the sessions informative. I'm sure that you will, and I hope that it will lead to action so that the sector can become better resourced in terms of benefits plans. So, welcome.
Thank you so much, Kathleen. While it's working, Charlene, you're going to want to still get over there, and you're going to be soon clicking that button on the slides. In fact, maybe you could just do that right now. My team said to me this morning, "Are you going to introduce us?" I said, "No, they won't remember anyway." If you look on your agenda, you'll see all their names, but it's Jim and Kirk and Charlene. We're going to be doing the breakout sessions together, so I think we'll have a full morning for you. The agenda. So here's our agenda for this morning. I'm just going to talk a little bit about who I am, why I think it's important for your employees to have benefits. I'm going to do a little bit of Benefits 101, and then talk about getting the most bang for your buck. How many of you are social services people who work at social service organizations? Not everybody. I wonder who are the rest of you? Where do you work?
Municipal government.
Municipal government? What else? Community colleges, education, sort of. Okay, I just want to have some sense of who's in the room. So that's sort of our agenda for this morning. Could I have the next slide, Charlene? I want to start off by a little tiny bit about who I am, because I think that really colors where I come from. I'm from a family with 10 children. I grew up in Windsor, Ontario, and in that 10 children, we never had just 12 people around the dinner table. There were always at least 1 or 2 foster kids. There were likely to be 2 or 3 kids from the neighborhood who just couldn't live at home anymore and needed some place to live, and they lived at our house. There was always a grandparent or 2. Our normal dinner table was 15 or 16 people, and that's just how I grew up. My parents were constantly reaching out to the community and trying to make the community a better place to live. So I grew up in that kind of grounding, if you will. I've had my last 15 years until I retired last May. I worked at a place called Semiahmoo House Society, which is an organization in British Columbia that supports people with developmental disabilities. And I've been working for about 39 years in the not-for-profit sector in one kind of role or another in senior management. 12 of those years as an Anglican priest. I sort of think of the church as a social service, except it's got this sort of overlaying kind of set of faith orientation. But a lot of what it does is a social. So I think it's part of my social service history. For 12 years, I've been a mentor trainer in person-centered practices with the Learning Community for Person-Centered Practices, which is a worldwide organization teaching people how to do better person-centered work in social services. I am deeply, deeply concerned for the welfare of the people that I work with, the people that I care about, and I'm also I'm a person who, with fellow executive directors, we started Community Services Benefits Trust. Now, one of the things I want to point out to you is that there will be times during this morning that it sounds like this is a commercial for Community Services Benefits Trust. Please don't hear it that way. It's just the only vehicle in which I know how to put what we've done. What I really would like to try to convey is there are things every one of us need to think about as we think about benefit programs for people that serve the sort of vulnerable public. And so this is really not about CSBT. It's just my only vehicle that I know how to express. So could I have the next slide? This is my mom. My mom, Peg Wheeler. She's 91. She'll be 92 next weekend. Lives in her own apartment in southern Ontario, just on the other side of London. I think probably the favorite thing I hear her saying to me lately is, well, two things. One, she says regularly and constantly to me and to all my brothers and sisters, we are blessed beyond measure, which is something that I carry inside myself constantly. But the other thing she's constantly saying nowadays is she's saying, oh, Paul, I'm getting so forgetful. Now, she never forgets the kettle on the stove, but she forgets most other stuff. She's getting to that point. And she broke her hip a couple of years ago, and since then is really mobility impaired. And if she didn't have people coming in 4 times a day, she could no longer live on her own, which for her would be devastation. Can I have the next slide? This is Patrick and Larry. Patrick and Larry are 2 friends of mine. They're young men who live with developmental disabilities, and they are at my wedding right here. The 2 of them were ushers at my wedding. Patrick is the guy on this side, closest to me, and Larry was also the bartender at the wedding, which he thought was really cool. These 2 guys have really full life, and I mean, way fuller socially than I do, that's for sure. Very engaged in their community, really live life on their own terms, and all of that kind of stuff. And I just want to point out to you that wouldn't be true if it wasn't for a bunch of people who are involved in their lives. And some of those people are family, but most of those people are paid people. And the key one that I want to talk to you about is a woman named Dineen. Now, Dineen is a worker that works with them in a program on a daily basis at Semi-Yamaha Society. And Dineen is she's a single mom, sort of 35, 36 years old. You never really know that stuff. 35, 36 years old. And what happened? There we are. And she has 2 little kids. So she's a single mom, 2 little kids. Okay? Larry and Patrick wouldn't be having the life that they really need if Dineen wasn't present. So now we want the next slide. So I want to talk about why employee benefits are important, at least in my mind. My mom could not successfully live in the community without those staff that support her. Larry and Patrick couldn't live in the community without Dineen supporting them. I really care deeply about Larry and Patrick and my mom. And I'm really conscious that the workers that work with my mother and Dineen are not paid anywhere near what they're worth. And my experience in social services over the last 39 years is social service employees are never paid all that they're worth. And so at the very least, I should make sure, I've always seen it as a trust, I think I should make sure that they have at least the best benefits that we can possibly give them. That if there's a medical event in Dineen's life, that it's covered. If her kids' teeth need fixing, that they're paid for. If someone gets sick, that they can, you know what, if Dineen's daughter comes down with some infection and they go to the doctor and the doctor says she's got to have amoxicillin, I don't want Dineen to have to think about, well, do I have tomorrow's lunch or do we have the amoxicillin? Because that is reality of life for people that work in social services. They do have to make those kind of choices unless they have a really good benefit plan. So that's one reason why I think employee benefits are important. If you just flip that slide to the next one, Charlene, I think employee benefit plans are important for other reasons as well. There's a table out in the thing where they're helping you recruit people for programs, and it says something about getting people of passion to jobs that really matter. And that's what I find really happens in social services. We find these people with deep passion who are willing to expend themselves in places where they don't get paid enough because their job really matters to them. So if we want to attract and hold those good people, we really need good benefit plans. Good benefit plans really create better morale among our employees. And when morale is good, the support that Larry and Patrick get is way better. And we want to be conscious of that. Good benefits, when they're well used, actually equal lower costs. And I'm going to talk about that more later. So I'm really convinced that better lives for vulnerable people, for Larry and Patrick and all the other thousands and thousands of vulnerable people in our communities, they have better lives if we have healthy employees at work. So what we do is we go out and buy employee benefit packages. Next slide, please. There's a problem with employee benefit packages. Mostly employee benefit packages are built by insurance companies and sold to us by insurance companies. Insurance companies, we need to be really conscious, are not accountable to us or to our employees. They're accountable to shareholders, and that's fair enough. That's how the companies are built. There's nothing wrong with that. But look at it just for a second from the perspective of long-term disability, if you have that. Long-term disability, in long-term disability, the insurance company is paid as a percentage of the cost of the program. So if the cost of the program goes up, that's not bad for them, that's good for them, because 10% of $200 is better than 10% of $100, obviously. We all understand that. So since insurance companies, what they do is they put the thing together, a good plan together, and then they adjudicate claims reasonably well. And they normally adjudicate them very fairly and very well. They manage the people that are on the claims on a day-to-day basis, normally fairly well, and they tend to get people off benefit as soon as possible. And that's not a bad thing, that's a good thing. Need some of this. The problem is, because of the way they manage people while they're on that claim, they give the people the attitude, the thought, I've got to keep proving that I'm disabled because they're out to get me and get me off benefits. So they create a disability mindset, which creates a block between employer and employee and creates a problem with the person potentially getting back to work. A problem so big that for people that are off work for a year, the chances that they will ever go back to work again are now at 10%. Once they're off for 2 years, the chances they will ever work in any occupation again are something like 0.1%. So it's really a problem doing it the way the insurance companies do it. I want us to think about looking at an LTD program from an executive director's perspective. Now, if I were creating a long-term disability program, oh, by the way, which I have, if I were creating a long-term disability program, I would use the benefit program, the package itself, to keep healthy employees at work, to support them to be able to do their job. I would make sure that what we would do is support the person to come back to work when they're ready and able to come back to work. And while they're off work, we would be giving them the message that your employer cares deeply about you, is interested in your best welfare, and wants to support you to get well. That's our primary task, is to support you to get well. And then when you're ready, we'll bring you back into the job. Your job will be waiting for you. Obviously, I would create that LTD program to keep costs down, and then I would take any savings I had and drive them back into the benefit program, and the employees would know about that. They would know that savings are coming their way. So if I was developing a long-term disability program, I would develop it so it was for the benefit of our employees rather than for the benefit of the insurer. And I'll tell you more about that program later on. I think we're going back one slide. Right there, right? Oh no, sorry, keep going.
Forward.
Let me just say one more thing about this particular slide, which I missed at the start of it. One of the ways we would give the best support to our employees as we did this program is we would have a really good disability management organization who would be involved with the employee from the moment they went off work. At my organization, we actually pay a little extra for the service, and the employee is contacted by the third day they're off work. And the call is about, your employer is concerned about you, how can we best support you? Are you okay? You just think about Dineen for a minute. If she's suddenly off work, really sick, let's say, she's got 2 little kids at home. Who's going to go out and buy a quart of milk? Those are the kind of things I'm really concerned about. So we set up the disability management program to get involved with her right away off work and begin to ask those questions. The normal plan, the employee is contacted on the 5th day of being out of work. And then the disability management program is involved with them. If forms have to be filed, the employee doesn't have to fill out the forms. The disability management program does. Disability management program is in touch with the doctor to make sure the right forms are filled out and filed and all of those kind of things. So somebody else is shepherding the employee through the whole process on behalf of the employer. So that's the kind of thing I would design, and by the way, that's what we all did. Now let's have the next slide. So if EDs were building the program for social service benefits, let's talk about how we do it. Our original thing, when we first got together, we had 8 executive directors in a room, and we had 5 of our local brokers. We had all been dealing with local brokers. Kirk here is a local broker, right? Sells benefits. So that's what we had. And we sat around the room and said, you know what, we think we can do better than the insurance companies are doing for us. We think we need to take control of our own lives. So we started our own benefits trust, and we call it C SBT. There are some must-haves, and you can see them on the screen here. Had to be not-for-profit, has to be owned by its members. We consider our moral ownership is the member agencies who participate in our plan. We only sell through trained and certified local brokers. We call them our partners. We are fully insured. The costs are totally predictable. The program is constantly evolving, and I'll show you more about that later. We really provide, there's got to be somebody at your agency who administers the plan, does the work, so we provide a system that provides maximum support to those people who do that. We're extremely flexible. We can meet the requirements of any collective agreement or any group that comes along and says we need something specific and interesting. We can do all of that kind of thing. And we are really committed to the best possible pricing and cost containment. So what happened? We chose a plan administrator. The brokers themselves said to us, here's who you should choose for a plan administrator, and here's why. So we did that. We found insurance. This was really quite interesting. We had clauses in our collective agreements that no insurer in Canada would meet. It was impossible to meet those. And we actually developed a relationship with Manulife at that time and talked them into taking on this really interesting clause, and since then have gotten insurers to pick up all kinds of things that insurers in Canada had not done before. We've trained our brokers, and we constantly train our brokers in the work that we want them to do. And we grew quite exponentially in British Columbia. We have now recruited partners right across Canada. The only province we're not in is Quebec. And we're not in Quebec because in Quebec the benefit system is very different. So we're not in Quebec, but we're everywhere else. We constantly train our board members. We found that our board members were all executive directors. They were great at managing things and leading things, not terribly good at governing. So we constantly train our board members how to govern this kind of a plan well. We started with 8 agencies. We're now at 330 agencies right across the country. And I think that's actually an old number. I think it's actually 335 agencies now.
339.
339 agencies now, thank you. And a little over 16,000 social service employees in the country. We're the biggest organization doing this kind of work in Canada. We continue to evolve and grow because we are always working on how do we get more bang for our buck for social service agencies. So here's a little bit about Benefits 101. So, one of the things that we need to be really conscious about is we all think that benefits are benefits. And it's actually true. A dental plan is a dental plan is a dental plan. For every dollar you pay into a dental plan, the insurance company is going to pay out about 80 cents in dental claims, and they're going to use about 20 cents to cover all the other costs of doing that kind of plan. If they pay out 90 cents, next year your dental plan costs are going up. That's just the way it works. So, a dental plan's a dental plan. So basic coverage is basic coverage, but not all plans are created equal. They're just not. So we said to ourselves, what if we provided the basic plan that somebody really needs? We put that plan together, and then we said, would it make it better for this plan if we added something on that supported employees better, supported the employer better, and we did that for free? Would it help us out? So I told you earlier about the Disability Management Institute, which part of the LTD program. We said to ourselves, if we included really top-end disability management in the middle of the LTD program, in the middle of the early intervention program, we believed employees would be off on sick leave and long-term disability leave for less time. They would return to work much earlier, and everybody would be happier. By the way, there's a ton of research that says what I just said is true. So we said to ourselves, is there some way we can include the disability management in LTD with no cost to the employer? And everybody said, no, it can't be done. So we went out to the insurance companies, and we found an insurance company who were prepared to say, we'll take a risk with you. We'll pay for the disability management program out of the insurance company's money, and we'll chart and see what actually happens. Do people come back to work sooner? Is less sick time used? Do our costs go down? So that's kind of where we start. We said to ourselves, would it be possible to contain costs that way? We thought, we found we could do things really differently, and we could have really great results. Can I have the next slide, please? So, long-term disability, I've really told you all about this. What we did is we added the best practices disability management, no cost to the employer. Employers and employees are both happy. Everybody's supported when they're off work properly, all that kind of stuff. And here's the kicker. While employees are much happier with the program and using it properly and all of that kind of thing, our costs for long-term disability have been flatlined for 7 years. Now, those of you in touch with benefit programs know that cost of long-term disability plans across North America have done this. They've been 10 to 15%, depending on where you are, 10 to 15% average for the last 15 years, increases. We have flatlined for the last 7 years. Can I have the next slide, please? We have a program called Managed RX. I'm not going to read the slide to you. What Managed RX does is basically we said to ourselves, look at 70% of the cost of the extended health care portion of a benefit package, 60 to 70% of that is the cost of prescription drugs. Is there any way we can get out in front of the quickly escalating cost of prescription drugs? Again, that is an area that has been rising over the last 15 to 20 years, about 15% of the year. 15% per year. The last couple of years, we've had a little bit of a reprieve because a lot of drugs have come off patent and they've become, the generic drugs have come out and become available. So that has helped contain costs for the last couple of years. That will soon end. And as the aging baby boomers, so many of us in this room, as we grow older, the use of prescription drugs is rising, obviously, and more biologics are coming on the market. As that happens, the costs are going to continue to escalate again. So we said to ourselves, is there any way we can get out in front of that? And what we did was we made a relationship with a central dispensing pharmacy that does the work really well, and we put together a formulary, a managed formulary that includes all of the stuff people need, but it insists on generic substitution and therapeutic alternative substitution. I will talk about those in a later workshop, so I'm not going to talk about them now. But it insists on those things and actually really controls. Both agencies that do managed RX save somewhere between 20 and 25% per year on their drug cost. And remember, those drug costs are about 60 to 70% of their extended health costs. So it's a huge savings to an agency. Again, what we find agencies do is when they find that savings, they say, let's plow that back into either the pay package or into programs for people that are vulnerable or into improving our benefit package. Can I have the next slide, please? We have a whole host of other incredibly important extras as part of the package. How many of you have accidental death and dismemberment as part of your? Fair number of people. You know, accidental death and dismemberment's a really interesting one. You got to lose your left ear and your right eye. Or I wouldn't have got it because you can't just lose your right arm. You got to lose your left foot at the same. You got accidental death and dismemberment. Nobody ever collects. Well, not nobody, but almost nobody ever collects on any of those policies. That's why they're so cheap. We went to the insurance company. We got them to change it. We have a thing called I never get this right. Accident and Serious Illness (ASI). costs exactly the same thing, but it covers a bunch of illnesses. So for instance, I had prostate cancer 6 years ago, and I got out of the hospital. I was home for 4 or 5 weeks, and the guy came around to my door with a check for $10,000. Well, now, $10,000 did not replace my prostate. But you know what? It was actually very helpful at that particular time. It meant a lot. We hand out a lot of those kind of checks to people because it covers things like if you have a heart attack or any of those kind of things. So a bunch of serious illnesses. I hate to even talk about this one, but we have a thing called a stillbirth benefit. I don't know if you know this, but a lot of people, as part of their plan, they have life insurance for dependents, right? But if a baby is born and it's stillborn, it's not covered. And we said to ourselves, it's not good enough. It doesn't happen a lot, but it does happen. And that family is suddenly faced with funeral bills and all that kind of stuff. So the dependent life coverage covers stillbirths. We have a thing called hospital indemnity cash. Anybody here ever been in the hospital more than 5 days? Or how many of you know somebody who's been in the hospital more than 5 days? This is more of a participatory reality than an audience. You can put your hands up, it's okay. One of the things I find when people are in the hospital remember I'm an old preacher, so I've been in hospitals a lot. When people are in hospital for any length of time, it is incredibly burdensome to be paying for that TV, and if somebody wants to come and visit them every day, their wife or husband or loved one wants to come and visit them every day, and they got to pay the exorbitant parking fees at the hospital. After 5 days, we give them $40 a day, no questions asked, it's non-taxable, to help pay for those kind of expenses. We have medical imaging services, so other than places like BC where it's illegal, if on an annual basis somebody needs an MRI, we'll give them $1,000 toward their MRI. We've increased dependent child eligibility to 26 years old because, how many of you got kids that are over 22 that are still at home? Yeah, a bunch of us, right? So some of them are still going to school, and the truth is, while they're still going to school and they're over 20 years old and all that, they need to be covered by benefits. So we did that. We have a thing, I love this one, Ceridian LifeWorks. How many of you have an employee and family assistance plan at work? How many of your employees really, really know they have that plan and they really use it well? Couple, that's good. 3, that's great. Because one of the things I want to tell you is sick time goes down, prescription drug use goes down. All those indicators improve dramatically when people really use a proper employee and family assistance plan. We include it free. There's no extra charge in our program. We're the only guys in Canada that do that. So you can buy it. You can buy it. Any employer can buy an employee and family assistance plan. It costs somewhere between depending on how you structure it, $250 to about $750 per employee per month. Our plan is the top-rated piece of Ceridian's work, and it's free because it helps control costs, and because we're good people. We have what we call a living benefit, and this is not uncommon. Somebody gets really seriously ill and now they're terminal, they're going to die. They can get up to 50% of their life insurance in advance to help with family things. And again, all of these enhancements to the program are present without additional cost. So, are we finished? No, we're not finished. At C SBT, and by the way, whatever you do with your benefit package, I hope you're never finished with making it the best it can be. That's the reason I'm telling you all this, is because I think it's such an important thing to the Dineens and all of the other people that work in the fields that we work in. It's so important. So we are not finished, and I hope you're not either. We have a vision. We want to be the premier purveyor of quality health and welfare benefit products to community services in Canada. And we have values. We have a passion for quality health and welfare benefit products that keep people healthy and on the job. And so we're going to continue to evolve. We're going to continue to grow, and we're going to continue to find better and better ways to do our program. One of the things we're doing toward this right now is we're building an advisory committee here in Nova Scotia. We feel that we really need people in each province who will come together, executive directors, human resources professionals, finance professionals from social services, who will come together on a regular basis and help us know what is unique about this issue in Nova Scotia, and how do we have to fold and form this thing to make sure it really works best for the people of Nova Scotia. So we actually recruited, yes, our very first advisory committee member yesterday, and I believe we're recruiting the second advisory committee member tomorrow. So if you're a user of the CSBT product and you believe in it, and you're a senior person like I just outlined, we'd be interested we are interested in building quite a large advisory committee here in Nova Scotia to help us with our work. Next slide, please. So the ways we're continuing to provide further and further input into our program, we provide educational days. We think it's really crucially important that employers and employees know about wellness, because wellness is one of the best ways to tackle the rising cost of employee benefit programs. It's also good for our employees if they concentrate on their own wellness. So we do educational days around that. This coming year, our educational days are going to be around how do you use the Ceridian LifeWork product really well? How do you make sure employees are trained in it and know to go to it? So when an employee comes along to their manager and says, I'm having a real problem at home because, my wife is just a spendthrift, or my wife is an alcoholic, or my husband has done this and that and the other thing, my husband is violent. Employees come along and they say those kind of things to their managers, their executive directors, those human resources professional. Are we using the resources at our hands? Every time I've had employees come to me over the years with those kind of questions, I've been really stuck with, what do I say? Where do I send them? Where do I find the resources? Now with Ceridian, we get counseling for our employees that are really properly trained professionals that know what they are doing, and they keep it confidential. So the employee's going to a confidential source. We are soon introducing a new piece of change to our long-term disability program that's going to result in a savings of 8 to 10% a year. We're increasing the training for our partners across the country, and we measure our success. For the longest time, we had our administrator would come to us and say, we've increased our premiums from this number to this number, and we kept saying to them, and they finally got it. We don't care how much premiums you're selling. What we care about is how many people are covered, how many people are getting the best possible benefits that are working in social services. Can I have the next slide, please? So we're going to keep on going. We believe in person-centered benefit solutions for Canadians. When we think of benefit solutions, we think of Dineen and May and Tara and all the people I know. We think of those people, and so we're trying to center on them as we build it. We're doing the best we can within the scarce dollars that are available, and I think I want to encourage you to look at what we're doing and then give us your ideas. We'd really like to know, we'd like to hear from you about things you need and how we could build those kind of things. We want to ask you to demand you get all that's possible from your benefit dollars. Benefit dollars are scarce. There's all kinds of people in Nova Scotia who are not getting anywhere near the benefits they need and deserve because benefit dollars are scarce. So it means we, as the leaders, have to be really proactive at looking where our dollars are going and really making sure we're getting the best bang for our buck. And then make sure each of your employees has the support that's needed for them. Can we have the next slide, please? So now, you know what? I'm not going to play the whiteboard. We only got 5 more minutes. Okay?
Mm-hmm. Yeah.
So can I have the next slide, please? We have that little exchange was because we have a whiteboard video that's 5 minutes long. If you go to our website, you'll see that whiteboard video there. In 5 minutes really encapsulates the entire structure of Community Services Benefits Trust, how it all works, all of that kind of thing. I wanted to introduce Kirk Longmire. I've mentioned to you a couple of times during this presentation that we only sell through certified, trained local partners. And so in Nova Scotia, we have 3 different organizations who are our partners. Kirk leads one of them. He's Copperstone. It's Copperstone Financial. Right. It's right there. And he has a booth out there. So if you want to talk to somebody about this kind of program, about our particular kind of program, this is actually the commercial break. You want to talk to anybody about our kind of program, please talk to Kirk. He'll be here he was here all day yesterday. Right on. Okay, so, and I think we got one more slide. No, we don't have one more slide, so you can go back one then. Leave that one up there. You can all write down our email addresses. So, we have 4 more minutes. Are there any questions, comments? Please.
Just one comment, and it's such a relief to see a package like this because I've worked in vocational rehab for a large company that has now been hired by companies like Sun Life and getting people back to work. And the focus actually is on, it really is a disability model. I've also worked in workers' compensation board.
Me too.
And the other thing about disability is it often becomes equated with inability. And the company that I worked for, my reason for leaving was when they introduced an incentive package. They had, and you think about how much money this is, for every province and territory, for the person who closed the most files in a month, you got a $500 gift certificate to a restaurant or a store, your choice. Second person was $250, third was $100, and that is in every province and territory. And I was doing the calculation going, really, this is not about helping people.
Yeah.
So this is a breath of fresh air. I still do quite a bit of work for some of the other companies in employee and family assistance programs. So I'm curious to know more.
Yeah. Thank you so much. I have to say, if Dineen ever goes off work in some kind of sickness or whatever it is, breaks her leg, you know what, I want her to come back as soon as she's able and all of that kind of thing. By the way, it's really important to Larry and Patrick that she comes back. They need her presence. But I don't want somebody being paid to cut her off before she needs to be back. I want her to be properly, so thank you so much. That's some really important stuff. Any other questions or comments, please?
Sorry, can I, hold on. Can I just do this, so you're on the last.
I also worked at WCB and other agencies. How do you deal with, hi Andrea, how do you deal with chronic pain, pre-existing, et cetera, when you're screening?
You know what? It's all set up plan by plan by plan. So, for instance, in the collective agreement that's for all of the unionized social service agencies in British Columbia, pre-existing conditions don't matter, and basically they're not screened out. In other places, part of the conditions of the plans that people set up. So an employer might come along and set up a plan, and the employer might say, well, we don't want if anybody's got a pre-existing condition in the last 2 years, then they're not eligible for 2 years or whatever it is, right? So it depends on how people set up the plan.
I really like your plan. I think it's really positive, but I think also the bottom line is the bottom line when it comes to financial.
Oh, absolutely. You know what? At the end of the day, you've got to be able to compete financially. Now, however, you really also have to differentiate between value and cost. So, if one of the interesting things to me is if you go to most employers and say to them, we're going to talk about cost. So, and you've always been finding the lowest cost. And they'll say, yeah, I've been really working to get the lowest cost all along. See, let's go back to 2001 and pull out your benefit cost statements from 2001. And now let's pull out your benefit cost statements for 2012 or 2013. Bet you, they're at least double. In most cases, they're more than double. So chasing lowest cost is not necessarily, chasing best value is. As I said earlier, we flatlined LTD costs for the last 7 years. So if somebody bought into another program, because that program was less expensive than we were, and now they've been in that other program for 7 years, where we were was here, where they were was here, but now where they are is here, and we're still right there. So, that's part of what employers, and employers themselves have to be the ones to begin to say, how do we find the ways around that? Because insurance companies won't. Any insurance company right now will buy your business. They will buy your business. And so you can always find a little lower cost. What we need to find is top value. And then keep the cost contained once we're in there. That's, for us, the biggest issue. Anyone else? We have, go ahead.
Do you have a minimum number of employees?
No, well, yeah. Basically, yeah, the question was about minimum number of employees. Typically, we have different kinds of products. Typically, the smallest group would be about 3. We do set up some programs for contract employees. So at Semi-Ammo Society, we have about 90 contractors who provide a living space for somebody in their own home. It's kind of like adult foster care. So we have a program that allows those people to buy one-off packages. But other than that, typically about 3 is the smallest, and there's no upper limit.
And that's what I'll be talking about in my breakout session, is exactly those 1s and 2s and the very small organizations.
So we have 4 breakout sessions that are happening over this next little while. They're all on the 5th floor, and the numbers are all in your packages. So thank you ever so much. Thank you.